Hey there, it's Dr. Hodges coming to you live from another one of my walk and talks. I swear the only time I make these videos is whenever I'm going out for my walk. Thank goodness I've tried to do this much more frequently. And I literally had a patient of mine tell me the other day when they came in for their initial consult, he said, you know, I watch a lot of your videos before I came to my appointment. You look different in person. And I was like, oh yeah, because I washed my hair. So please forgive me for my less than formal appearance. But if I'm going to get these videos made for you guys, this is as good as it gets, okay? So I want to talk a little bit more about COVID-19. Clearly, it's a very timely topic. And I recently did a video on the 411 of COVID testing. And a couple of the things I'm going to talk about today, I touched on during that video. And today I just really wanted to speak briefly on what you can do to decrease your risk for developing COVID-19. And what are things that we can just do as a community as well. You know, COVID-19 is a respiratory illness. It is right now known to be spread via respiratory droplets. There has been a lot of different studies on whether or not fomites can cause transmission. And if you ever hear somebody say fomite, that means just something hanging around. So can you get it from a utensil? Can you get it from a box? So when Amazon brings our boxes, can we get the disease if we touch the box? When we go to the grocery store and we touch that jug of milk, are we going to get the disease? And there really hasn't been any documented cases of transmission via fomite. However, the recommendation for disease prevention is going to be the same. Wash your hands. Wash them for 20 seconds with soap, or use an alcohol-based sanitizer that's 60% alcohol or more. So I had a sweet little patient that came to me, and she had been doing a lot of her quarantining, and it was always this humongous production for her to go and get her groceries and then to ultimately get them unpacked from her home. And I just want you guys to know that the jury is out, and there's very low risk for disease spread via fomites. However, I would encourage you that before you go to the grocery store and once you get home, wash your hands. After you put away all your grocery items or open up that Amazon box, wash your hands. So because this is a respiratory illness, it works in similar ways to other respiratory diseases, which is why some of the basic tenets for transmission and disease prevention are going to be the same as the common flu. You need to wash your hands frequently. You need to wear a cloth covering and practice social distancing. You will notice that whenever I'm going out for my walks, I'm not wearing a mask, but you will also see all around me, tain't nobody around me. Isn't it pretty over here? Anyway, it's, I would like to say it's my neighborhood. It really isn't, but I digress. So, but there's no one around me. The recommendations right now are, if you can keep social distancing, you don't necessarily have to wear a mask. So for instance, when I'm going for my walks, I do not wear a mask. I currently do not go to a gym. If I was in a gym, I would certainly want to alcohol swab my hands before and after using any piece of equipment. And unfortunately, I would also wear a mask, which is one of the reasons why I don't want to go to a gym, because I think I would feel a little constricted wearing a mask. But if you want to be safe, that's really what you need to do. You know, I will say this, I find it so unfortunate that this disease has become so political, because it's just a disease. We just need to do things to help to prevent it. And we hear it on both sides that it's not political. Is political. All you have to do is watch TV and see that. But some of these things that we're asking to do, it's just common sense. Now, what about taking vitamins? Can a vitamin help you with your disease prevention? there is a really good podcast that I enjoy listening to, and sometimes it can be a little woo-woo, but it still has some great information, and it's all about health and longevity. And the guy that produces the podcast, I mean, he's doing everything under the sun to help to maintain his immune system, maintain optimal health, taking all these different vitamins and supplements. But the reality is, you can do all those things, but if you're right next to someone and they cough right in your face and you breathe it in, you might get COVID. So right now there's no supplement that's out on the market today that's been shown to help to prevent infection with COVID-19. And that would include vitamin D, vitamin C, zinc, copper. Everybody likes their little copper bracelets. Some people have wondered, if I put copper on things, will that kill the virus? Also UV light. While yes, UV light has been shown to kill viruses, the best way to stop the transmission is just to wash your hands with soap and water. You don't need to UV light your body or UV light all your food whenever you get it in from the grocery store. What are some other things that you can do though? Because I said optimize your health. You know, are there certain people that might be at a higher risk though for developing COVID-19? What puts them at a greater risk? If you have heart disease, if you have diabetes, if you have chronic respiratory disease, if you are obese, these are all independent risk factors for developing COVID-19, and unfortunately for having poor outcomes from the disease, having a more aggressive infection. Does that mean that every time that somebody has diabetes and they get COVID-19, they're going to have a terrible infection? No, but all the studies show that it ain't good if you have diabetes. So if you have these health problems, what should you do? What can you do besides taking the usual measures of wearing a mask, washing your hands, and social distancing? I think you just need to try to optimize your health the best that you can. If you are a diabetic, you need to do everything in your power to optimize your hemoglobin A1C. That means you need to take your medicines regularly. You need to be following your PCP or your endocrinologist recommendations for diabetes treatment. You need to be watching your diet, your carbohydrate intake. All of these things are going to help you with control of your diabetes. As a side note, crossing the street. As a side note, bariatric surgery has been shown to put diabetes into remission. So I do think that if you are really concerned about your diabetes or COVID-19 or any other disease process, just know that bariatric surgery can certainly help you with your diabetes, and then that might, having help with your diabetes may help you mitigate your risk for having poorer outcomes should you be infected with COVID-19. If you have high blood pressure, what can you do? You need to take your medicine. I cannot tell you how many of my patients come to see me and they're like, yeah, my doctor gave me my medicine, but I don't take it. And their blood pressure is like through the roof. And I'm like, oh my God, you're gonna have a stroke right here in my office. So if you have high blood pressure, take your medication. Watch your salt intake. Try to get a good night's sleep. Watch your stress. Some of these are more simple, common sense things. I'm trying to think, what else have I been reading? There seems to be like a lot of old wives' tales. I mean, I think that we've all seen these things on the internet of somebody trying to drink that hand sanitizer, things like that. I mean, come on. Let's just use good judgment. But in the end, it's really going to be just being vigilant. Even if you think that you've been exposed, it's going to be self-monitoring, possibly self-quarantining, so you can protect the people that you love around you. So I hope that this has been helpful. Mask up, social distance, wash your hands. I know we always just keep all of our gloves in my little car console, along with a little hand sanitizer. And we suit up every time we go out, and we hand sanitize and wash our hands when we get home. So I hope that this has helped you guys. Certainly, if you have any further questions, you can always chat with your PCP or your healthcare provider. You can also get a wealth of information from cdc.gov. They're going to have a lot of different guidelines on almost any topic pertaining to COVID-19. It is being updated on a regular basis. Actually, whenever you go to many of the pages on the CDC website, it'll first have a couple of disclaimers. This was updated on this day. This was updated on this day. So you can see they really are trying to be vigilant about giving you the very best up-to-date information as possible. So you guys, stay safe, stay healthy. I encourage you to do everything that you can to keep yourself healthy and keep the people around you healthy and safe as well. So please give me a thumbs up. Don't forget to subscribe and share this with your friends. And wash those hands.